this idea that you get to control and make your healthcare more personal. Yes, we need the skill that a doctor has to consult with them, but ultimately it's your body. You have to decide what you want. If you have a thyroid disorder, don't you think that getting a thyroid test once a quarter would be more beneficial so you could see over time what your thyroid is doing?
Even once a month,
and then all of a sudden it becomes the same price. I could do 4 thyroid tests in a year and see a picture of how my health is doing in my thyroid for the same price as one thyroid test that was billed through insurance that didn't get covered and I paid $100 and whatever for. I can do, if I have diabetes or pre-diabetes, hemoglobin A1C needs to be tested. My glucose needs to be tested. And I can either go to a doctor and say, I can pay $200 for an appointment to get my lab test ordered. Go get the lab test, come back and have the doctor read it with me. Or in a direct consumer state where I can order my own tests, I can come in and get my hemoglobin A1C tested 3 times before my annual physical. Take it with me and show the doctor a picture of my health over the year, where then the doctor can make much more informed decisions because they're seeing who I really am through my blood.
And you order it, and that test only costs $30 or $40,
Right. And really what that's doing is it's putting the consumer in charge of their health care. And that's what really needs to happen.
Yep.
And I think any doctor, I would hope, any doctor that's taking care of a patient should be okay with that. Because let's face it, I mean, doctor literally, if you look at the Greek meaning, means teacher. And ultimately, at best, a patient sees a doctor 1 hour every 4 or 5 months. Okay. That's generous, actually, probably.
Oh, yeah.
Yeah.
I mean, really, honestly. So
usually you only see your doctor for 15 minutes or 10 minutes.
And that's once a quarter or something, right? I mean, so let's just say an hour a year, but you've got 24 hours a day to take care of your body.
Yes.
Right.
So one of the reasons that we did this podcast is to educate and empower consumers to take charge of their own health. No matter what disease you have to take charge of your own health. Yes, you have to seek lab services, pharmacy services, and doctor services to help you do that. But ultimately, the consumer's got to be in charge. And that also means, in my opinion, ultimately, financially, they should be in charge.
Right.
Right.
Because that's going to give the best quality and service.
Yeah.
Yep.